Your patience, everyone, and we're going to get started. So again, my name is Stacy, and this is our monthly Compassion in the Classroom, and I'm really excited today because we are going to meet Dr. Clem, who's one of our amazing vets. So I'm going to turn the camera around so you all can start seeing what I am seeing. So as you can see, it is a really, really busy place, and we have a lot going on. And we're going to learn about all the great things that we do here in our medical center at San Diego Humane Society. So I might have to kind of stand close to Dr. Clem while I'm talking so you can make sure to hear her. So please, Laura or any of the teachers, let us know if we're having trouble hearing anything. So this is Dr. Clem. Hi. So we're just going to have to kind of talk loud, Dr. Clem, I think. So we're gonna,
No problem.
so maybe we'll first do like a little reverse here of hi, Dr. Clem.
Hi, everyone. Welcome to our hospital.
Yes.
So excited to have you here today.
Excellent. So first of all, Dr. Clem, how long have you been a veterinarian?
I've been a veterinarian for over 10 years now. It went by fast. Time flies when you're having fun.
That's right. And what exactly is a veterinarian? I know that we all think it's an animal doctor, but what kinds of things do you do for the animals?
Oh, so many things. And it really depends on what type of veterinarian you are. There are many different types of veterinarians, and I happen to be a shelter veterinarian, which is one of the coolest veterinarians in my opinion. So cool because you never know what's going to walk in the doors. There's always something new, and you might be seeing an emergency case and treating an animal with a broken bone, or you may be doing a life-saving spay or neuter surgery to help keep pets healthy and live a long life, or doing dental work on an animal who needs an infected tooth pulled that might be really hurting them. There's so many things that we do as shelter veterinarians, and our main goal is to get animals into nice homes with people so that they can enjoy that kind of bond with a human. And so what we're doing here is getting those animals ready for an adoption home. And so whatever they need, we will provide that for them.
Excellent. And what I think is really cool, I'm going to turn you around because is that as a shelter vet, you could have a hamster, you could have a tortoise, you could have a horse, a pig, a dog, a cat. So you get to work with all different kinds of animals,
Yes,
which I think is exciting.
Is really a fun part of it.
Yes.
And there's no shortage of species here in our shelter, and that makes it really fun too.
Yes, and you can see we have Andrea here, who is one of our vet assistants. So there's lots of people who work in the medical center. And then we have a vet tech back here who's wearing demo. So we have all these different people here at the hospital, at the medical center, who help take care of the animals. And I know you're going to show us kind of how you take care of an animal here today.
That's right. Yeah, I do have a patient that I need to do a recheck exam on. So Andre, would you be so kind as to grab Sunshine for us? Yeah. And we'll get started with our exam. So Sunshine is a approximately 2-year-old male intact, he's a neutered kitty. And so he came to us because he has a broken leg. And so he has a splint on right now, and a splint or a cast. You may have seen this before on animals or even people. And we'll use this to stabilize broken bones or other types of injuries. And so he has that on him now, and he's feeling really comfortable. He's gotten some pain medications to help him feel really nice and comfortable. But eventually we're going to do a surgery to fix that broken bone. And so that's going to help give him the best chance of recovery and be able to completely return to normal and be able to run and jump and do all the things that cats love to do. So we're going to recheck him today and make sure he's doing well as we plan for his upcoming surgery.
So when an animal comes to the shelter and they come into the medical center, what are you kind of looking for first? So do you give an exam to the animals? Well, and here's one now, so you can kind of talk us through it.
Yeah, this is
Sunshine.
Sunshine.
Here's Sunshine. Oh, and he's going to be real talkative. So
Yeah. So, cats in a hospital, especially in a shelter, as you can see, there's a dog back there. There's so many new things for them to observe, and so it can be a little frightening. So I'm actually gonna switch places. I'm gonna go to that side, and I'm just going to help me with a little distraction for this kitty. This is something that we do often in the animal hospital. It's a fear-free technique. So we want to make sure we minimizing anything fearful or stressful for an animal. So when we have to do an exam or maybe give them a shot, we like to distract them with pleasant things like treats. And so that makes everything a little bit less scary for them. And so I can look at him. Usually with an exam, I would like to look at their face first. I look at their eyes and make sure there's no goopiness, no discharge, and look in their mouth as well. He's a little bit stressed out, so I'm gonna skip that part for today because the main thing I'm interested in is just seeing how his leg is doing. You could see that this cast here is open, so we can see his little toes, and that's important because we want to make sure this isn't too tight on him and not restricting the blood flow. So it looks like his toes are nice and pink. They're not swollen. So he's looking really good. And I think he's doing great. So we're going to get
Dr. Clem, do we know how he broke his leg or did he come in this way?
You know, most of the times we don't know what happened to them. And that's part of being a veterinarian is detective work because the animals can't talk to us. And oftentimes we don't have any people who can tell us what happened to them if they were lost or abandoned. And so we have to piece together all of the evidence based on our clinical exam, our physical exam, and also diagnostics like x-rays. So I can show you his x-rays if you're interested.
Oh, yes.
And that's what helps give the veterinarian an idea of what the problem is, and then we can decide how to best treat it.
Yeah, so I love what she said, because if you're a vet at like an office,
You back?
I think we lost you, but we are back. Okay, and Sunshine was happy for us to stop looking at him. So we are going to go back, but we're going to get to see Sunshine's x-ray, which is kind of cool. So she was saying what I think is the coolest part about being a vet at a shelter like this, like she said, like Dr. Clem said, there is, we can look at this if that's okay. Oh my gosh.
Our turn, we can.
Yeah, this is a dog getting an x-ray. I would let you talk. Sorry.
Yeah, who are you all working on right now? Conundrum. Okay, I can see you're taking x-rays, and another fear-free tactic that we are using is sedation. So this dog is actually sleeping right now. We gave him some special medicine and he's connected to some gases that help him stay nice and sleepy. So he has no idea what's going on. So he has no reason to be afraid because he doesn't even know this is happening. Otherwise, this could be a really strange experience for an animal who doesn't understand that we're trying to help them. And so one of the ways that we can make this more pleasant is just give them a little sedation, and then we're able to get all of the pictures or x-rays that we need to help figure out how to treat this animal. So you can see up on the screen, we have some nice images of his abdomen. You could see the spine going down the center and all of his loopy intestines all around filled with gas. And so our veterinarians are going to take a look at that and figure out what they need to do next for this pet.
So yeah, so you can see that blue tube is feeding medicine that is making him asleep. So he is completely asleep and is in real deep sleep. And because you can imagine a dog would not stay still like that, right? If we asked him to lay on his back. So that's another thing she said. So now he's comfortable. He's just taking a really nice nap.
You can see our assistants here are wrapping up the packs. Yeah. You can see our assistants are wrapping up instruments right now. This is a pack of instruments that we use in surgery because just right over there, if you look through that glass, you could see all of our surgeons and they are doing spays and neuters right this very moment.
What is a spay and neuter?
Oh, good question. So we come around.
Yeah. So spay and neuter, I've heard her say those words a lot, and it's one of the it's the most frequent surgery that we do at the animal shelter.
That's correct. So spay or neuter surgery is a procedure that we perform to ensure that a pet is not able to have babies. And the reason why we want to do that is because we already have so many animals in the shelters that are waiting for their perfect homes. And so we don't need more animals. we already have plenty to go around and plenty that are just looking and waiting for homes. So by preventing those unplanned litters, we can ensure that animals in the shelter are able to get adopted and get the chance to live in a home. And this is also providing many medical health benefits for the animals because it can prevent certain types of cancers by getting them spayed or neutered. And it can also help prevent them from wanting to escape the home and get into trouble, like an accidental hit by a car or something like that. So this is really good for the pet. It's good for all of the pets in general. And it's a very quick and easy procedure. Our veterinarians are highly skilled and trained in doing this specific procedure, and they do it with such frequency that it can take as little as 5 minutes, if you believe it. And the animals recover so quickly. You can actually see some.
Yeah, so there's like a 3-step process, right? So here's where they get ready. So we're gonna shave their belly or shave the area where they're gonna have a surgery. They're gonna get all sterilized. Then you can see here, we have actually 3 surgeries going on right now. So in each one of these tables, 1, 2, 3, is a different surgery going on. So we have all of those, everybody in a blue coat like that is one of our veterinarians, and they're waving at us. So yeah, so they are doing really important stuff right now. And then yeah, here, like Dr. Clem said, is recovery. So what's happening here? So these animals, here, why don't you can speak, unless you want to point at something. Yeah.
This is one of our cats who just recovered from a spay or neuter surgery. And we take this opportunity while they're still waking up to clean their ears, trim their nails. We're making sure that they're waking up nice and warm. These blankets with the red air in there is actually circulating nice hot air to keep them warm and comfortable as they're recovering. And you can see another animal is on station number 1, ready for a neuter. And he's already been shaved and disinfected so that area can have surgery next. And then that'll just take a couple minutes and then he'll go to the recovery mat with this other little friend.
Perfect. So yeah, so I don't know if any of you out there have ever had a surgery, but it can be kind of confusing, right? You know what's happening and you get the medicine and you wake up in a different room. And so animals here, they don't know what's going on, right? So they don't know what's happening and where they are. So like you've seen, everybody is really kind and spends time with them and makes sure that they're waking up peacefully and getting lots of attention. And we have lots of cool stuff on this tray here, Dr. Clem.
Yes, speaking of surgery, I was thinking about showing you some cool things here. So these specimens are a result of many different surgeries that we've done here in the shelter. This one was a really special result of a spay that we did on a chameleon. And these are follicles. These are tiny follicles, what it would look similar to eggs, but this chameleon was producing lots of follicles. And usually a chameleon is able to just pass those as they produce them, but sometimes they get stuck. And chameleon's abdomen is not much bigger than this. So this was taking up her entire abdomen and starting to feel really full and really uncomfortable. So our veterinarians had to intervene and do an emergency spay on her to remove all the follicles that were causing her discomfort, as well as all of her reproductive tract, so that she wouldn't go on to produce these again in the future. And it was a successful surgery, and she lived a long time after that.
So a chameleon is like a lizard, or like kind of like an iguana, or so similar. It's a reptile.
Think of Pascal in Tangled. That's
Pascal and Tangled.
Yes, so that little character is a chameleon.
We have Cute Happy Dog over here getting ready. Okay, excellent. So
yeah,
cool
so
stuff.
we have a little eyeball. So sometimes a life-saving surgery would be a nucleation. And a nucleation is when we have to remove an eyeball if it's too injured or infected to save. And that can help keep the patient alive and comfortable.
And usually if we're removing an eyeball, it's because it's causing them pain.
Correct.
Or it's infected or it's hurt. So it's already bothering them. So usually when we're removing an eyeball, they already can't see out of it. But animals are amazing, right? So even if they lose an eye or a leg, or sometimes they are amazing and figure out how to use it without it.
That's right. And these are also something that was really causing a lot of discomfort. These are stones that were inside of a bladder of a dog. And so sometimes dogs and cats can start developing little stones in their bladder, and they can get so big and we have to take them out. So a surgery that we do to take out bladder stones is called cystotomy. And it involves making a little incision into the bladder and just scooping out those stones and then closing it back up with some stitches. And they do really well afterwards. And that gives them a lot of comfort.
I can't imagine having all of these in one dog's bladder. That
Oh
must have
my
been really
gosh, it
painful.
must have been horrible.
Yes.
Sometimes a little more
Ooh.
subtle would be something wrong with the kidney.
So,
And this is actually a kidney that was removed. We may need to do this if the ureters are blocked. Those are the little tubes that connect the kidney to the bladder. And so we actually have a cat in our care right now who had to have a kidney removed because of that reason. And the kidney was just getting so big and full that it was causing a lot of discomfort for the cat. And when we took some x-rays and some ultrasound imaging, we could see that that kidney was much bigger than it should have been, which helped our veterinarians figure out that he needed surgery, and we ended up removing it, and the kitten is doing great. I can show you in a minute.
do you
if
think this doggy might like to be touched by you?
Sure.
Maybe just see, oh, where are you going to, doggy? Okay. Maybe just to hear his heart and show what you would do for an exam. Would we be able to do that? Live animals are always the cutest. What is this guy's name, Chris? Or gal? We'll figure it out. We'll
Ernest.
find out.
Yeah.
This is Ernest. How great.
So anytime I do an exam, especially if a new dog that I'm not familiar with, I want to make sure that I give him some space, let him smell my hand first. You never want to just go
Oh.
right up to a dog, especially up to their face. And so having.
And that's a good
handler-
idea for you when you're meeting a dog too out there.
Exactly. So once we kind of get to know each other, then I might just kind of pet him, let him know that I'm not here to hurt him. And I'm gonna just move really slowly and watching his body language. You can see his tail's wagging. He's pretty comfortable and relaxed. So I'm gonna listen to his heart right under his elbow here. Here, loved up, loved up, loved up. Sounds really good and normal. And on the other side, I'm gonna listen to, and it sounds great. And I'm listening to his lungs that are a little bit higher than where I would listen for the heart. And I can hear him taking nice, clean, deep breaths. He's actually panting. That means he's breathing a little harder. So sometimes they do that when they're nervous or hot. And so in this case, he's probably just a little nervous because this is a new place for him, new people. But he's got some little warts, some skin tags. So we'll check that out and we'll do a full exam on him.
So what's cool at the animal shelter is if an animal comes in who needs medical care, we can provide that. So that might be, like she said, he has some little growths on him. You can see right there, that little pink one. Or she's going to look at his teeth. And maybe sometimes they need what's called a dental or a teeth cleaning. Sometimes teeth have to be pulled.
Yeah.
And he says, yeah.
So he does have a little bit of tartar back here. You can see it's a little stained. So he could probably benefit from a teeth cleaning. And I like to look in his ears. They're a little bit red. And so I might want to look in there deeper with an otoscope. It's a little cone that has a light and a magnifying glass that will let me look inside his ears and see if there's any sign of infection or foxtails. That's a little piece of plant that we have a lot of around here in San Diego, and they can get stuck in the ears and the skin and between the toes. So I always like to look into their ears to make sure they don't have anything like that. Good boy.
So you can see, yeah, again, you guys getting lots of love from Andrea, just, the assistants help and make sure that he's feeling comfortable and that tail keeps wagging. So that's really important,
Yeah.
that they feel comfortable.
So I might feel his belly too. This is something called palpation when we're just feeling inside the belly. So I'm using my imaginoscope. So I know about roughly where his bladder should be down here. So I'm feeling for that. I kind of know where his kidney should be right under his rib cage. So I'm feeling for those and feeling his intestines, just making sure everything feels like it normally would. And the more animals I do an exam on, the more I learn what normal is. So I can tell when it's abnormal. And I'm also going to look at his legs. I feel his knees to make sure nothing's painful or crackling, and just make sure everything's working well. And it looks like he's in good shape.
Because remember, when you go to the vet with your pet, with your family pet, you can tell them all sorts of things, right? Like say, oh my gosh, he hasn't eaten in a few days, or he's not going potty, or he feels really tired, and normally he's really active. And like Dr. Clem here, this is the first time she's meeting this dog, and there's nobody with him to say all those things. So if he's not feeling well, she has to kind of be like a detective to figure out why that might be. But he looks like he's feeling just fine. So he might be here for something else. But I know we have lots of patients in the back room, so we can kind of, and then Andrea, maybe we'll get the little cutie. Do we want to see?
Yeah, Chanel.
Yeah, Chanel, we have a very adorable grand finale for you, but while we're getting that set up, we can just show like, so that you can see there's always stuff going on in here. Do you see all these doctors? They have the dental suite, so much going on, a dog waiting for an exam, always stuff going on. We have a stroller, we'll tell you probably why. But are there any animals back here that we could, that she knows?
That I told you about that we had to remove the kidney.
Oh, yes. So once we're gonna meet the cat who had to have their kidney removed.
It's Tuesday.
And you just saw the kidney in the jar. Well, not his kidney, but
Right.
a kidney.
And look at how
Aw,
wonderful he is. You would never know that this little guy only has one kidney. He doesn't know it. He certainly doesn't know it. He is a nice, happy, healthy kitty. He's got lots of treats and food in here to eat, and he's been snacking all day. And he's actually going to be going home today. He's doing so good after his
Yay.
surgery. You could see he's got like a little bit of a incision
we
there.
got his little
And so,
surgery.
you know,
spot. Yeah.
But he's a good kitty. He's really happy. He's feeling good, and he's going to live a nice, long life.
So it's really, really important when with your pets that if you notice that they are not feeling well or if they're hurt, that you need to take them to the vet to make sure that they're getting their care because if it's left untreated, that's when it becomes a problem, right, Dr. Clem?
That's correct. Yeah, early detection and prevention is the key. We even have a bunny in here. So
Oh my gosh, we have
we have a
Blaze, oh my goodness, look at this cutie.
I know, look at his little nose.
Look
So cute.
at those tiny ears. Oh my gosh, hi. So yeah, so we, like they said, you have to know, our vets have to know how to work with all different kinds of animals because yes, they could have a bunny come in or a tortoise. I think you've had a peacock. What is the
Yes.
most interesting? You are very cute. You need us to stay on camera. What is the most interesting surgery you think you've done, or maybe most interesting or coolest animal or something?
Oh, for sure, the coolest that I have gotten to do was a fracture repair on a mountain lion.
Oh, did
because
you
we
hear that? A
work-
fracture, so a broken bone on a mountain lion.
Yes. a
So we help
mountain lion.
wild animals too.
That's right. And which I approached it just like I would with a cat, with a pet cat. The bones are very similar, just a lot bigger. And this mountain lion had a broken bone, and our friends at the Project Wildlife team let us know that it needed some repair. And so we were able to do a surgery to put a metal plate and some rods in there, and he healed up nicely. The Project Wildlife team actually helped watch him for several months, and he was able to be rehabilitated or returned into the wild where he could run and jump. And it was a beautiful thing to see that.
That's very cool. So you see the animals that we have here are going to be available for adoption. And some of them already have homes and some are looking for homes. But like the wild animals that she was just talking about, the mountain lion, or sometimes we've done surgeries on bears or all sorts of things. Those animals, oh my gosh, here's our finale.
Yeah.
Those animals are going to clean up. Are any wild animals like that are released back into the wild. Okay, so do you see this cutie here? So Dr. Clem, I think your voice when you're
Sure.
closer can make it.
Yeah.
For you. Tell us all about
Okay,
this one.
this is Chanel. She is a cute little French bulldog, and she came to us with an injury. I think she was actually hit by a motorbike, and so it probably impacted her back. In our backs, there are little bones called the vertebrae, and in between there are little little discs that cushion in between the bones. And sometimes those discs can just slip out of place and it can pinch the nerves in the back and it can affect things like the use of their legs. And this little gal had that kind of an injury. And so she's not able to use her back legs, but she can use her front legs and she's just ready to go. We fitted her in a little wheelchair and she is adapting to the wheelchair so well. I don't think it took her even any practice at all. And she just takes off. I think, all right, let's see. We'll show you. Here she comes.
It might be too high. There you go.
There you go. There she goes. Good job, Chanel.
She said we're gonna go.
Oh my
So
God.
she's really happy, really comfortable. She's not letting it stop her. And so we're gonna try and give this little girl a second chance and find her a home as she recovers.
And she'll obviously need special care. So look at her little feet up there. Do you see her, how her feet are up that? Like, why do you have to put her feet up like that?
Yeah, we have to suspend her feet like that so that they don't drag on the floor and they can eventually get little scrapes and wounds if we let them drag. So keeping them up high keeps her safe and protected and and then she can just let the wheels do their job. She's such a good girl. She may never regain full control of her legs, but she's not going to let that stop her.
And so, yeah, so she'll need a special home that's able to care for her and she'll need a special level of care, right? So she'll use her
Right.
wheelchair when she needs to go on walks, but other times she can, look at her go. I love it. She doesn't know there's anything stopping her. Look at that. That's amazing. Laura, do we have any questions you want to ask the vet while we have Dr. Clem here? Is there anybody who has a question about maybe anything else she does or how you become a vet? And what I'd like to show you is there's lots of different careers here. Like I see Andrea in the blue. She helps, vet assistants help with the care of the pet, right?
Everything.
Like this, taking her for
Yeah.
potty.
They do everything from, caring for the animal, assisting the veterinarian in our exams, even in surgery. They are
Doing laundry, keep everything clean.
Yes.
They're great assistants.
They are, and the veterinary technicians are also really important. They have even more responsibilities. They can actually give them medications to put the animals under sedation. They can help with putting splints on. So over here, we're working on a patient kind of cleaning up a wound, I think. They'll put in a catheter in case the animal needs some fluids. They can set up all of those more technical things. And the veterinary assistants and veterinary technicians are really the powerhouse of the vet clinic. And we have lots of veterinarians here too, which we're really grateful for because we can see so many animals at the same time. And you can see there's so many animals receiving care
So many people.
at the same time. And we wouldn't be able to do all the work we do without the entire team working together.
So they're kind of, if you've ever been to the doctor or to the hospital, they're kind of like the nurses to the doctors.
Correct.
So
Yes.
everybody works together though to make a big difference. Oh. So yeah, lots going on at all times. So does anybody have a question? I know we started a little late, but we're happy to stay on if we have any questions or if there's something else that you would like to see that we didn't see. So you can see, there's the dog that was on the
I did.
X-ray.
There had been a hand up, but then it went down. Was there a teacher that wanted to unmute? You can do so now, or you can put it in the Q&A or chat.
See, it's very busy all the time.
I think people might be having to hop off. It looks like we lost one of our participants, but
Okay, we might have to
anyone
head out
does,
of
like
11.
Stacy said, we were a few minutes late getting started, so we're happy to stay on a couple more minutes if there were any classes with questions, but I don't see any now. I think you shared
Okay,
a lot of great
covered
information
everything.
with us.
All right, well, thank you, Dr. Clem.
so
Thank you for
much.
being with us
I
and teaching us
appreciate
all
it.
this cool stuff.
Yeah.
And thank you everyone for joining us. And next month we will be at our Project Wildlife Center and we'll get to see how we take care of our wild animals in our community. So hope to see you then. That'll be in February. And we hope to see you guys again. And thank you for joining us and have a great week, everybody. Bye.